Welcome to Wellness Talk. Today we will discuss the emergency treatment of a common injury among children and adults: wounds. A wound is an injury to the body that typically involves laceration or breaking of a membrane, such as the skin, and usually damage to underlying tissues. They include cuts, scrapes, scratches, lacerations, and punctured skin. If not treated properly and timely, it will result to systemic complications. This include bacterial infections such as cellulitis, which are infection the affecting skin. Another complication is osteomyelitis, which are infections affecting the bone. And worst, untreated wounds lead to septicemia, which is infection affecting the blood and the whole body. So here are 10 steps in the emergency treatment of wounds. Step 1. Apply direct pressure to the wound for 5 to 10 minutes. If the wound is bleeding, apply firm and direct pressure with a clean cloth or your hand. To stop or control the bleeding by promoting formation of a clot at the bleeding site. Step 2. Clean the wound immediately. Gently rinse the wound with clean soap and water to remove dirt, debris, and bacteria. Avoid using harsh antiseptics or alcohol, as they can damage healthy tissue. Step 3. Control bleeding with elevation of affected part of the body. If the wound is on an extremity, elevate the injured area above the level of the heart to help reduce bleeding. Step 4. Apply a sterile dressing on the wound. Cover the wound with a sterile dressing or clean gauze to protect it from further contamination. If available, you may apply effective antiseptics like Hyclens or Trameal ointment that doesn't damage the skin. Secure the dressing in place with adhesive plaster or a bandage. Step 5. Use a tourniquet as a last resort. Only consider using a tourniquet if severe bleeding cannot be controlled by other means. Apply it proximal, above, to the wound, but make sure to release it for a short time every 15 to 20 minutes to prevent further tissue damage. Bring immediately the injured person to a clinic or a hospital emergency room. To determine the underlying cause of the severe bleeding or other severe injuries inside the body. Step 6. Apply ice or cold compress to the bandaged wound. If the wound is not actively bleeding, applying a cold compress or ice wrapped in a cloth can help reduce swelling, pain, and inflammation. Step 7. Keep the wound clean and dry. After initial cleaning, keep the wound clean and dry to promote healing and prevent infection. Change dressings regularly, like daily, and avoid exposing the wound to dirt or contaminants. Step 8. Seek medical attention for deep, gaping, or severe wounds. If the wound is deep, gaping, or caused by a dirty or rusty object, it is advisable to seek medical attention to assess the need for stitches, antibiotics, or tetanus shots. Step 9. Avoid certain substances that affects wound healing. Refrain from using hydrogen peroxide, iodine, betadine, or alcohol-based solutions to clean the wound, as they can delay healing and damage healthy tissue. Step 10. Update tetanus immunization with your physician. Avoid the wound to develop a serious complication like tetanus. If the wound is caused by a dirty or rusty object and it has been more than 5 years since your last tetanus shot, it is recommended to receive a tetanus booster to prevent tetanus infection. In summary, these emergency treatments are just general guidelines to treat the wound. It is important to seek professional medical advice for serious wounds or if there is continuous bleeding even after treatment. Before we end, don't forget to like and subscribe to get our latest videos on health and wellness. Embrace health. Unlock wellness beyond the ordinary.